This is the IBJ podcast for the week of January 27th, 2020, brought to you by the law firm Krieg DeVault. I'm Mason King. Welcome back to the podcast, everybody. The Indiana General Assembly is back in full swing. Lawmakers started the 2020 session on January the 6th. With plans to wrap up in about 2 months. This is one of these biannual short sessions, meaning legislators aren't trying to write a budget this year or get too deep into the revenue and spending issues. But make no mistake, there's a lot happening, and these sessions can be bewildering. There already are more than 450 active Senate bills and another 450 or so House bills. Many of them apply to the same issues, but in slightly different ways. And some of the issues that they're tackling have been brewing for months and even years. Now, everybody knew going in that in some fashion they were going to address hot-button issues related to teacher pay and student testing, the smoking age, health care, and how to spend some of that $410 million in budget surplus from 2019. We are right in the thick of committee hearings now, and you need a spreadsheet to follow those adequately. But we have something better. IBJ state government reporter Lindsey Erdody has been patrolling the Statehouse for the last 3 weeks and is prepared to share the highlights and surprises. Lindsey, thank you for carving out some time in your schedule.
Thanks for having me.
Sure. Before we get started, I don't know if this is a good question or not. Generally speaking, how many bills that are filed in a short session, that's a tough one to say, actually make it to the governor's desk?
Oh, a fraction of them. There's such a long process bills have to go through. I think some people don't realize it necessarily, but they start in one chamber. They have to be assigned to a committee. Then they have to get a committee hearing, and a lot of bills already die just in that they don't get a committee hearing. Then they have to pass out of committee to go to either the Senate floor or the House floor, go through second reading and third reading. They do amendments on second reading, move it along to third reading, gets a vote on third reading, and again, bills are dying all through the process at these marks. And I mean, so really it's already a feat to get to that point and to cross chambers, and then you repeat the whole process on the other side of the chamber.
That is the part that gets me every year, is once you get to just the part where they need to reconcile the bills, and then just stuff kind of flies in from nowhere.
Yeah. So that's the other thing, too, is that even though a bill might die, whatever that bill was trying to do, that language can get amended into another similar bill on a somewhat similar topic.
Right, with a day's notice, or maybe not even that.
Absolutely.
Okay, so these first 3 weeks are relatively civilized then.
Civilized, but fast.
Okay. We talked a little bit before the podcast about the overarching theme of this year's session, at least so far. And I've termed it much ado about nothing. Am I right about this? What do we mean by that?
I don't think you're wrong. So a lot of it, like we said, they are doing a lot. There are a lot of bills moving, and they're on subjects that we certainly care about, education and healthcare and spending government dollars. But looking at healthcare, what is the actual impact those bills are going to have is something I think we'll talk about more in depth later in this podcast. And that's certainly in question. The tobacco 21 bills, how much impact is that having when the federal government already decided that it's illegal to sell to individuals under 21? And on the education thing, again, some of those things they had been talking about for months, so it's not surprising things like the Hold Harmless bill has moved, and other things like teacher pay they're staying away from.
Which they've signaled for months that they basically didn't want to open up the budget, as they would say, to really address throwing more money towards teachers, or at least in the general direction of schools.
Right, yeah. Republicans have definitely said that it's not a budget year, so they don't want to go down that road. And I think that's why, to get back to the much to do about nothing, because it's not a budget year. And so I think a lot of lawmakers are saying, well, anything that touches taxes or revenue or spending in any way, that's got to be dealt with in 2021. We're not going there this year, except for the surplus spending bill that they are willing to touch.
There we go. Yeah.
Important caveat.
Yeah. Let me ask you more about teachers. Now, as you remember, really the first big event of this year's session was the Red for Ed Action Day on November the 19th, well before the session really started in earnest, when thousands of teachers from across the state demonstrated at the Statehouse. And they're asking for, as I recall, a number of things. They wanted the state to allocate part of the total $2 billion budget surplus to schools. pass a hold harmless provision to protect teachers and schools from the consequences of the surprisingly low 2019 iLearn test scores, and to repeal some recently passed licensing requirements that they found onerous. So have the teachers' interests been reflected at all in what the legislature has done so far?
Yeah, absolutely. Other than the teacher pay issue, what teachers wanted is really what lawmakers are pushing towards right now. And it seemed like a bit of a surprise for some of us following along. The House Republicans coming out in support of decoupling teacher evaluations from test scores. And that was something House Speaker Brian Bosma brought up when they outlined their agenda for the year. And it seemed like his caucus was certainly in support of it. We were a little surprised to see that passed unanimously out of the House. And for weeks, we kind of heard it has an uncertain future in the Senate. And we just heard this week that it seems that more members in the Senate are coming around to it. So that could end up making its way to the governor. And I think teachers would be pretty happy about that, too. I'd say the one thing they're really not getting is teacher pay.
That's interesting about decoupling, the testing scores from teacher evaluations. I mean, that feels like, from my memory, my admittedly faulty memory, kind of a big shift in philosophy from maybe 8 years ago when people were really pushing to come up with a way to evaluate teachers so you could figure out how much to pay them.
Yeah, it seems like on a lot of this education stuff, we like to try one thing, see how it works, and then we evaluate and say, well, that's not working or this is working. And I think now you're just seeing lawmakers say, well, you know what? We thought that was a good idea then. Now we don't think it's so much of a good idea, so let's just get rid of it.
Now, as we said, the question of paying teachers, at least sort of initially, was tied toward surplus. And one of the first things that the legislators did at the beginning of the session was figure out how to spend the hundreds of millions of dollars from the state's 2019 budget surplus, which was about $410 million. And I kind of found that a little surprising since lawmakers generally love to brag about the size of the surplus, because we talk about needing to have an adequate safety net in case or in the event there is another recession.
That money that we ended up with at the end of 2019 was unexpected. It was going above and beyond what we said we needed to have in the bank, basically, just in case something happens. And so the governor had come out right after we got the year-end figures and said, I think we should spend, almost $300 million of this on a few of these projects, and listed out some capital projects at universities and the now infamous swine barn at the Indiana State Fairgrounds.
Right. This is the $50 million that he wanted to allocate to, essentially like rebuild the swine barn at the fairgrounds.
Yes. Right now it's a open air structure, and the
it
new
is
one,
hotter than hell.
The
in
new
the
one would
summer.
be enclosed, and it would be quite an upgrade for the swine
needed.
barn. The key was that these were projects that state lawmakers had already included in the budget they passed last year, but they were planning to issue debt to pay for these projects. And Holcomb's suggestion was, let's take this cash out, pay for these things up front, and avoid taking on debt and avoid having to pay interest. That proposal shifted a little bit by the time we got to state lawmakers getting their hands on it, not unusual. And it changed to having funding for 6 capital projects at universities throughout the state.
Right.
And the swine barn got taken out. But the project's still happening. It's just not being paid for in cash.
Oh, okay. Oh, so it will still happen.
Yes, it will still happen.
Right, but we'll be paying the mortgage for a while.
We will have bonds on it, yes.
I gotcha. All right. So $291 million, I think, was the amount that they wanted to spend on these.
Correct.
On these projects that they just thought, we need to do this, so let's pay for it in cash.
Correct. And the thought was, this is going to save us, more than $100 million down the road that we can spend on other things. And that bill moved extremely fast through the Statehouse this year. That bill is already headed to Governor Holcomb's desk.
Oh, my goodness. Oh, that was just like in the last day, wasn't it?
Yes.
Yeah. Why did they want to tackle this so fast?
There's conflicting opinions, I think, on why they wanted to tackle it fast. Republicans will tell you that it's because there was widespread agreement that this is how they should do this is how they should spend the money, this is good fiscal policy. Democrats, I think, would argue that Republicans wanted to push it through because they didn't want more proposals coming in on how those dollars should be spent. Because Democrats would argue that this bill opens up the budget. I mean, it is a spending bill. They'd say that's opening up the budget. And if you're opening up the budget, we've got other things we'd like to spend money on, like teacher pay.
The longer the money is hanging out there,
the more
it becomes an issue.
Right. And Democrats did try to amend the bill along the way, and all of those proposals were shot down by Republicans who have the supermajority in both chambers.
Right. Well, let's move, while we're talking about school kids, to the tobacco age. So in November, the Indiana Chamber of Commerce said one of its top legislative priorities was to get state lawmakers to pass laws to decrease the smoking rate, of Hoosiers and get vaping products out of the hands of young people. To my memory, this question of whether or not to raise the smoking age has kind of held on from previous years, and it usually has fairly large support, but it never quite makes it to the finish line. What's different this year?
We were talking about this before the session because even before the session started, we had heard support coming from House Speaker Brian Bosma and from Governor Eric Holcomb, and we hadn't seen that before necessarily. And they were saying that, well, now veterans are telling us, the military is telling us that this is something they want. The interesting thing is military and veterans had been talking about this before this year too. So that's not technically new. I think other people say, well, it takes a while for an idea to get through the Statehouse sometimes. And so even though there was a push for this before, it took us until now to finally get over the hump, so to speak. I think it would have had a good chance even before the federal government took action, but we saw Congress include it in a bill to raise the smoking age to 21. And so now it's kind of seems like a foregone conclusion that these are going to pass. I will say the interesting thing about the debate around these bills at the Statehouse level, though, is that the state is in charge of enforcement of this and penalties on retailers. So that seems to be where some of the hang-up is in terms of what those penalties on retailers are going to be and if we need to increase them or not. And so it was interesting to see on both the House and the Senate side different versions of the bill doing mostly the same thing. I mean, at the end of the day, still raising the age to 21, but has different penalties for retailers. But on both sides, there was a somewhat lengthy debate before the vote, and not everybody voted for him.
So where is that right now?
So the House and Senate have both passed their own versions, and we would expect those to flip. So the House will consider the Senate one, and the Senate will consider the House version. At some point, those will be reconciled, and we'll end up with one bill.
And this is to raise the cigarette and I guess vaping age as well, and also whatever kind of penalties would be enforced against retailers for selling to younger kids.
Yeah, so the federal law, it's important to know, only deals with purchasing or selling, and the state level has to do with possession. And like you said, I think it's also important to mention that this applies to vaping. And I think the vaping crisis in youth also kind of prompted more people to say, okay, maybe it is time to do something now.
Yeah, that was the thing that was different for me this year, was kind of the widespread realization that vaping rates among high schoolers are astronomical. I mean, so surprising.
Yeah, they've definitely gone up in the state, and I think the worry is that these kids who are vaping now are going to turn into smokers.
All right, let's take a quick break to hear from our sponsor. This is the IBJ Podcast.
The IBJ Podcast is brought to you by Krieg DeVault, a trusted and dynamic law firm representing a wide variety of local, regional, and national clients. Committed to each other and to every client, Krieg DeVault prides itself on integrity, professionalism, respect, and excellence. Financial institutions, global manufacturers, national healthcare providers, and successful organizations of all sizes and market focus rely on Krieg DeVault to create innovative and successful business solutions. Connect today at www.kriegdevault.com.
All right, we're back with the IBJ Podcast. This week we are talking with IBJ's legislative reporter, Lindsey Erdody, about the 2020 session. Republicans, which as you say, essentially control the Statehouse, seem to have a sudden interest in addressing high healthcare costs. What's behind this push?
Well, we found out earlier this year, a study came out that showed Indiana's hospital prices are much higher than other states. I think there's 25 states in that study, and ours were at the top So that got people's attention. I mean, you'd heard anecdotally, and there's been, certainly some data along the way of high healthcare costs and people complaining about healthcare bills, but that really put a spotlight on it and made lawmakers and Governor Holcomb realize that, well, something has to be done, because they started hearing from businesses talking about, how healthcare costs are resulting in them not being able to give employees higher wages. It might delay an expansion project. It might stop a business from wanting to locate in Indiana because of our high hospital costs, which then could end up being a higher cost for them to do business here.
There are many bills that are going through the House and Senate. What are the major themes, the things that they address?
There's a few big measures that are getting a lot of the attention right now, and they focus on a way to end surprise billing, which, essentially means I went to an in-network hospital and somewhere along the way, some doctor did something, touched me in some way that was out of network. And now I'm going to get a bill for that doctor that, maybe saw me for 5 minutes. And I didn't expect that, and I didn't know they were out of network. So they're trying to prevent that from happening and saying that you can only charge the in-network rate if you're at an in-network hospital. And then there's a push to create an all-payer claims database, which is essentially this giant database online that you or I or anyone else could go on and say, okay, I need to have a knee replacement. What is it going to cost me? And you type in a zip code and see a list of all the different places you could go for this knee replacement and what it's going to cost you and your insurance company. The databases can vary, but that's the idea. And then you are essentially trying to be a smart shopper, so to speak. And
yeah, but you still have to do the work.
Right, you still have to do the work, absolutely. And then another thing that's kind of tied to all of this too is requiring healthcare providers to provide you a cost estimate in advance if you ask for it. So again, it's on the patient to ask for that cost estimate, but they would have to produce a good faith cost estimate is how they're describing it, because they understand, you could go in for a procedure and they think they're going to do one thing and then they get in there and something else is going on and they have to address it. And so there's only so much you can do with the cost estimates. But
yeah, and as you mentioned at the top of the podcast, I mean, there's some skepticism about how much, these initiatives are going to really move the needle.
Yeah, absolutely. On the surprise billing one, for example, the state cannot regulate the self-funded insurance plans, which according to data I've been shown from various people in the industry, that's about 43% of Hoosiers
who are in self-funded plans.
On self-funded plans.
Okay, so a big chunk.
So yeah, and there's some disagreement over whether or not the legislation as it is worded now could apply to them or not. One of the lawmakers who's authored one of the bills has said he thinks it can apply to them because he's not regulating the plans, he's regulating what a doctor or a hospital can charge, which is a very technical workaround. Another lawmaker responded to him and said, well, I think that's going to be fought out in the courts. So there's that debate about whether or not how many people that's really going to apply to. And then on the all-payer claims database, or even providing this cost estimate, that's not actually reducing costs really in any way, not directly. It's just saying this is what the cost was, or this is what the cost is going to be. And in the states that have a database like this already set up, there has not been any evidence yet to show that prices did drop in those states. So there's some skepticism over whether or not Indiana would somehow be an outlier in that and have prices reduced here. But, the people who are advocating for all of these different measures continue to say it's about transparency. We don't have a lot of transparency right now, so at least let's get transparency, and then maybe we can figure out a way, once we have more data, to find ways to reduce the costs.
There's some promises that since next year is a budget year, they're really going to get after it next year. Or are they not even thinking that far ahead?
Oh, they could definitely come back to it next year. And when I asked Governor Holcomb about this, he seems optimistic that these measures are going to have an impact on costs right away. But he, too, said, we're going to come back next year and work on this even more. But, I mean, the all-payer claims database, even if they do go forward with that, that's years away from being publicly available and having all that data there, just because it's going to take so long to find someone to set it up, to get it running, to figure out exactly what we want in there, and to gather all the information. And the information that would go in there, it's also questionable how helpful it could be or how much information will be in there because, again, the state cannot tell the self-insured plans to contribute information to that database. They cannot require them to do it.
I'm going to use your mention of Governor Holcomb as my segue into the next segment. He surprised us, I think he surprised us, by revealing back in early December that one of his legislative priorities would be promoting a hands-free driving law, aka prohibiting drivers from holding their mobile phones while operating their cars, not just texting, but actually holding them in their hands. That was a surprise, right? I mean, had he talked about this before?
I had not heard him talk about it before, no.
So a little more than 1 month later, how much progress has been made on that?
That was one we were definitely watching to see what would happen because Republicans in the House and the Senate seemed a little iffy on whether or not that was something they were going to want to do. But we saw this week, we did see a bill filed with it in there, and it got a hearing, and it passed out of committee unanimously. And they listened to about 2 hours of testimony, and no one spoke in opposition of it, which was a little surprising.
Wow.
So now it's headed to the House floor, and we'll see what happens there. Every week when we talk to Speaker Bosma about where his caucus is on things, we kind of get a little bit more of an update on it. And it seems like we've more Republicans are coming around to this idea, but there is definitely some members on that side that are going to have an issue with taking away what they see as like a personal freedom, and that you should have the right to, why are we getting in the middle of someone's way and telling them what they can and cannot do in their vehicle?
I think I mentioned that the state already had a ban on texting. I mean, there's precedents for, limiting what you can do on your phone while you're driving.
Yeah. So that law took effect, I believe, in 2011. And police and Governor Holcomb have said that it's basically unenforceable because it's hard now to see or for a police officer to tell what you're actually doing. I mean, are you checking Facebook? Are you on Twitter? What are you actually texting? It's so hard that it just hasn't worked. And to their credit, in 2011, I don't think they saw that coming. I don't think that's what we thought was.
I did.
So now they're saying it's as simple as, is your phone in your hand while you're driving your car?
Yeah, much
yes
more
or
practical.
No?
Now, what about hands-free stuff, though? What about, I've got the Bluetooth hooked up, and I've just told my device, say I want to call my wife and tell her I'm going to be late.
That's still okay. You just cannot physically hold your phone in your hand while you're driving, because an interesting point got brought up in the committee hearing about like Uber and Lyft drivers, which frequently have their phones mounted on something in their car, and they're following the maps, accepting new rides, and using it for directions and whatnot. And that would be okay. You can still have it mounted there and push buttons with it because you're not physically holding it.
If it was up to me, we would also ban 4-year-olds from cars because those are also sort of distracting, but that's another story.
Right. And that's something people have definitely talked about, that they know, because like I just said, your phone could be mounted on something and you're still touching it and using it, and that would be okay. But the point is, this seems to be better than nothing, and there are so many distractions in cars that we can't regulate them all.
What we haven't talked about are the Democrats. Have they had any luck with any of their priorities?
Some of these things are definitely not partisan. Yeah, the healthcare stuff is certainly not partisan. The tobacco 21 bills are not partisan. The education stuff, they've certainly been all in favor of holding the teachers harmless for those iLearn scores and decoupling the test scores from teacher evaluations. Like I said, that passed the House 100-0, which you just don't really see very often. They disagreed with the surplus spending, but the hands-free driving bill, I would imagine, gets support from Democrats as well. It did in the committee level, at least. There's obviously things they wish were moving, like decriminalizing marijuana, which we haven't really seen movement on. A lot of the bills that pass do have bipartisan support at the end of the day.
Now, there are a couple of things that I think that we anticipated at the beginning of the session that I don't think we've heard much about yet. Tell me if I'm wrong. Redistricting reform?
Redistricting reform is dead. Sorry to those who wished it was happening. But that's the word we got from Speaker Bosma and Senate President Pro Tem Roderick Bray this week, and that none of the bills in either chamber are going to move on redistricting reform. That means that things are going to be the same as they have been. So the legislature is in charge of redistricting. That's going to remain. There's been a push to have an independent commission be in charge of redistricting. That's not going to happen. There was another bill filed this year that addressed basically more transparency in the redistricting process and gave the public more of a chance. It would have created like an online mapping tool for you to go on and draw districts and submit it and say, I think these should be the districts. And
sounds like an art contest.
Right. And, there was nothing saying that lawmakers had to consider those submissions, but they could. And we might see, you don't need a law to make that happen. So we might see more transparency come down the road. But in terms of legislation on redistricting passing this year, I suppose it's too early to say it's absolutely dead, but when the top two leaders in both chambers are saying it's not moving, it seems pretty safe to say.
Wow. So for the rest of the session, is there anything big that we still haven't heard from yet that you're expecting?
I don't know if there's anything big necessarily, but there are a lot of other small things moving along that I think are interesting and have some sort of impact for the business community, like the bill to honor professional licenses from other states seems to be moving along a little bit. And another important thing for businesses will be the unemployment trust fund rates. And as of right now, we're seeing they're just going to hold steady. But I think it's important to note that businesses otherwise would have seen a drop in the rates. And so holding steady, some would argue, is technically an increase from where it would have been otherwise.
That's the amount that businesses pay into the unemployment insurance fund.
Correct.
To pay unemployment insurance.
Correct.
But everybody's worried that if there's a downturn, and suddenly there are tons of claims, that there's enough money there.
Right, exactly. And the federal government tweaked their guidelines for how much they think we should have. And so state lawmakers are just trying to make sure that we're matching what the federal government says we need.
Okay, well, let's check in then in a few weeks and see how things are going. You're doing a great job, Lindsey.
Sounds good. Talk to you then. Thanks.
My thanks again to Lindsey. You can read more about the legislature's effort to control healthcare costs in Lindsey's story in this week's edition of IBJ. And before you get on with the rest of your week, I want to draw your attention to a few more stories. Sam Quinn details how IUPUI has tried to recruit more minority students, which is part of a national trend. Where it has made the most progress is with Latinx students, whose numbers have more than doubled since 2010, while enrollment of Black students has plateaued. Also in this week's issue, John Russell examines how local hospitals are trying to beef up their options for cancer treatment and get an edge in one of the most competitive and high-stakes corners in healthcare. And Greg Andrews has the latest in the FAA's investigation of a local private air carrier used by some of Indianapolis's most prominent executives. The probe is entering its 7th year without any end in sight, which has prompted some of the executives to fight back. Again, you can read these stories in the copy of IBJ that you have delivered to your home or office, or you can find them online at ibj.com. And remember, to get full and unfettered access to all of IBJ's award-winning business content, just click that subscribe button. Thanks again for making time this week for the IBJ podcast, which is edited by Leslie Weidenbender. I'm Mason King, and we'll be back again next week.